Okay. Good morning. Nice to see you. Nice to have you here with me.
And good morning to you from across the ocean. It's nice to be with you.
You know, here in Poland, we are huge fans of your books. They are really known here, especially the resilience book, the resilience workbook. And it was the first book of you that I read, and I love it. I recommended it to many of my clients, to many psychotherapists with whom I worked. And we have also translated your book about self-esteem as well. And I love it. I use ACT technique in my work. And I love that there was some part of ACT approach as well in this book. And we are here today to talk about your third book, translated into Polish, the book about adverse childhood experiences. Is it like that this is your last book? It was written like the last book, or?
Yes, this came out in January of last year.
Okay.
Quite recent.
Yeah, so this book is being translated right now into Polish. And well, I would like to talk with you about the concept, about the book, about some recommendation you would have for people with ACEs, with this kind of experiences. But I would like to start with you and with your professional path, with what made you an author writing about ACEs. Was there any path that led you here? Could you tell me and Polish leaders, Polish fans about that?
Sure. I think everybody has a path, and mine, I guess, I was an Army officer during the Vietnam era, and I saw a lot of my friends come back with post-traumatic stress disorder, and I had no idea how to help. And then I taught 3 years in the public schools where I saw young people with broken homes and suicide and rape and drugs, and I didn't know how to help then either. Then I went and got my doctorate degree at the University of Maryland, and there was a stress program there, and I was hired to stay on as a faculty member there. And it was all from the bottom down, biomedical. And I started thinking, well, wait a minute, people, when they're stressed, they get depressed and anxious and traumatized. And so I started writing books about the psychological aspects of stress. And during that time, I also taught at the Pentagon, and we had a lot of people in the Army and civilians that were getting premature heart attacks because of what was then called type A behavior, which was anger and hostility based. And then I started working with soldiers, firefighters, and policemen. And they're a very vulnerable group. And typically we think, well, it's your job stress that's causing all these problems. But if you look at the research over the last 20 years, you realize that the foundation of the vulnerability starts with what happened in childhood very, very often. So I thought, okay, there's 20 years of research about adverse childhood experiences, and I didn't see anything on how you help someone heal from that. So I decided to write the workbook, the Adverse Childhood Experiences Recovery Workbook, to help people know what they can do on their own and to help professionals know how they can help clients better, and also when to know when to get professional help, because sometimes that's needed.
Yeah, that's what I found in your book, that is very resourceful, both for patients, for people who need help, but also for professional people, for therapists, counselors, and other professions that they they can encounter ACEs on the way. So yeah, so it's definitely something that can be used by both groups, clients or people who will be clients maybe, and also by professionals. Could you tell me a little bit more about this ACEs concepts? I know it, but probably some people will, see this book and will, think that I don't get it, what it is. Because, in Poland, it's not so known, the concept of ACEs. Could you just tell a few words about it?
Sure. So the original research back in 1998 took the 10 most common disturbing events that were reported among 17,000 people who went to, a doctor's office, and they only looked at the 10 most common bad things that happen in childhood, and they were 3 kinds of abuse: emotional, sexual, or physical; 2 kinds of neglect, physical and emotional; then living in a home where there was domestic violence or a parent who was absent, typically from divorce or separation; that someone in the household was using drugs or mentally ill or suicidal or incarcerated in jail. And just looking at those 10, that was the focus, and they were found to predict all sorts of problems. And of course, now we know that there are many other adverse childhood experiences, like it's not just loss of a parent from separation and divorce. It could be death, it could be deployment, it could be violence on the streets, it could be surgery from the mother, surgery for the child. There's just a whole range of negative events that basically change the brain and the biology of the child. And the events I should mention are events that happened from birth to 18 years of age. And really, we should probably include the last trimester of pregnancy. Bad things happen to the mother that gets transmitted to the child. And, and all these things tend to wire the brain in ways that keep the brain on high alert, and that doesn't bode well for the child as an adult.
Okay. In my psychotherapeutic practice, I hear a lot of people saying, but it was like 20 years ago, 30 years ago, 40 years ago. I don't want to, talk about this stuff. It was so long ago. Why do you want me to talk about or to touch this, this neglect or abuse or, other experiences if it was so long ago? What would you answer such people if they just don't see the connection? It's just how something could happen in the in the first years of their life can influence them so much.
Well, and that's just the point. I think we get used to being under stress and don't realize the connection. And that's why, if a clinician has a good handle on the research, you can say, well, look, if certain things happened in your life, whether you remember them, and most of the time they're not consciously recalled even because of the way the brain develops, these things don't register in the logical verbal left brain, which consciously recalls memories. It registered in the right brain, which is nonverbal. It has strong connections to the survival and emotional aspects of the brain. And so people, maybe they're 40 or 50 years of age, and they have this sense of dread, and they have no idea where that originated. And often it originates in things that happen, say, the first 3 years of life before the left brain is even online. It's not even developed yet. And so this is stored often non-verbally, often below subconscious levels, but it shapes the brain the way it develops. The brain develops in a way that is wired to be on high alert. And so the grown adult may be anxious, they may be traumatized, they may have a sense of shame, and they don't really often connect where it originated. But then once you see, well, okay, now it makes sense. I get this wordless sense of dread or this wordless sense of fear. How many times have we seen people that are successful, in the workplace? They're maybe attractive, maybe they're likable, and yet they loathe themselves, they dislike themselves. Well, adverse childhood experiences often solves that puzzle. And then once you know the origin, you know what to treat. Because a lot of times treatment for just adult problems is not completely helpful. But if you can heal the original wounds that are driving those symptoms in adulthood, people feel better, they get better, they function better, they're fully there for their families and themselves and their colleagues.
Yeah. Wow. I hope my clients will listen to this conversation, because sometimes they're like, it cannot be linked, it cannot be connected. But when you look at the brain development, it just can be like this. And I was...
It is instructive here. I might just add a few things. ACEs predict in a stepwise fashion, you name it, and it probably predicts it. So the more ACEs one has experienced, the more likely one is to experience mental, psychological, medical, or even functional problems as adults. And I could tell you cases of people that once they healed the wounds, they got better. But things like depression, anxiety, PTSD, ADHD, suicide attempts, these things tend to increase 4 to 5 times when people have experienced 4 or more adverse childhood experiences. But for other things like suicide, that goes up to like 37 times greater. Think about it. If a young person is sexually abused or raped, that doesn't just go away with time. Typically, you get embedded a sense of shame, like I must not have been worthwhile if somebody did that to me. So, drug use. We use drugs to kill a pain, and so we send people to rehabilitation programs. Well, you can stop the drinking, but if there's unresolved pain from a wound that happened way back, you continue to drink to kill a pain. So it's not just some, crazy notion. There's 20 years of data have shown the links between early childhood wounds and adult health and functioning.
Yeah. And all what you said will also influences the way we can treat people with ACEs. Especially when you mentioned that we have these 2 hemispheres and one is not well developed at some certain period of time. The left hemisphere, which is responsible for language, narratives. And when I think about therapies that only focus on talking, on narratives, on this verbal functioning, maybe they will not be, talking will not be enough for some people, for people with ACEs.
Exactly. It may not only be enough, it may be the last step, not the first. Because you know that when people can put words, tell their story, that calms the brain. But a lot of people are not ready or able to talk about traumas, especially traumas from the early years that are not stored in the left brain, not managed by the left brain. So you don't start typically with talking, and that's what we train our people in graduate schools. Well, tell me what you're thinking, tell me what you're feeling. Doc, I can't tell you, I can't even, first of all, it's too scary for me to go there. As you indicated, a lot of people don't want to bring up the pain, which keeps us stuck, by the way.
Yeah.
But they can't find words. And so that's the time when you say, tell you what, I notice when you start talking about that you get tense and your face gets white. How about we put the story aside and do what's called bottom-up skills? To me, this is the missing piece of the trauma puzzle. Let's working with your body, which is connected to the survival, emotional parts of the brain, which are more strongly linked to the right brain, not the left brain. So calm the body, then calm the emotions and the survival tendencies, which are managed particularly by the right brain. And then we can get our arousal back into a comfortable level where you're able to talk when the left brain does come back online, because severe stress will either throw us into hyperarousal, or sometimes in exhaustion, in hypoarousal, where people get frozen, immobilized. But in either extreme, the left brain is offline. All you care about when you're fighting for your physical or psychic life is to fight or flee. You're not concerned with thinking and talking. And so the first step is, let's get back into the resilient zone where arousal is neither too high nor too low, where you're able to talk. And once you can calm the body, the right brain, then you can tell your story. Then you can do maybe what we traditionally train our people in graduate school to do.
Yeah. Yeah, what I notice when I work with people with ACEs is that sometimes they can even talk about their experiences, but they do it like they would be numb without any like emotions, like it would be some actor speaking about his role or her role. It's like there's this disconnection between words and emotions, body sensations.
Yeah, so that's when you start by saying, okay, let's get the parts of the brain online that connect yourself to your feelings, your body. All that stuff goes offline when people are overstressed, when their stress is dysregulated, meaning stuck on too high or too low.
And what I found extremely useful in your book is there were many useful chapters, but one of them is about psychotherapy. What kind of psychotherapy choose if you have experienced ACEs, and you mentioned body-based therapies, expressive arts therapies, and EMDR. And I would like to especially ask you about the last one, EMDR, because sometimes people tell that it cannot work. It's just strange. It's like how can it work? Could you tell me and the people who will be listening to us a little bit about EMDR? Why is it good for people with ACEs?
Okay, so let me just back up and say that it's a normal tendency to want to avoid what hurts. And this is why people resist talking about wounds from the early years. I just want to get by it and get back to normal. If that works, terrific. But it often does not. And that's when you say, there is a way to let pain in and sit comfortably with it. The mindfulness approach is very effective, where instead of pushing the pain away, which only makes you stressed and it doesn't change the painful memories, you say, what would happen if you just sat for a moment, notice where in your body you feel that pain? Let's say it's in my gut. And what would happen if you breathe compassion into that area and just let your gut soften around that pain and feel compassion soothing the pain? And I liken it to holding a child who's crying. They run into the house and they've fallen and scraped their knee. You don't say, well, bad kid, don't think about it. You say, well, come here, let me hold you and cry it out and then go back to play. And that's kind of what, to me, mindfulness does. It says, let the pain in, and there are very very powerful ways to do that so it doesn't overwhelm people. But just hold it in a kind way, breathe compassion into it, take a deep breath, and then let awareness of that area dissolve. So you don't stay stuck in the pain, you let it in, you soothe it, and then you go about your business. And so for some people that's a revelation. I don't have to keep running from pain and thereby keeping the painful memories stuck as they are without changing them. Okay, so just about everything that helps in resolving traumatic memories uses this principle of reconsolidation, where the brain is able to change a memory if you bring all of its component parts, all of its elements into full awareness. So you don't fight it and tense up and say, I don't want to think about it. You say, whatever it is, let me feel it. Okay, this is what happened. This is what I felt in my body, my gut, my tight chest, my tight throat. This is what I sensed. This is what I heard, what I saw. This is what I thought. And importantly, because we have to get the right brain involved, images. So it's not, the thoughts are kind of important, but they're the kind of the least important. What's going on within the body? What is the body taking in? What are you seeing and hearing and so forth? What emotions are you feeling? Soothe all of that. And that's when the eye movements tends to put the fragments of a memory together so the brain can change it. And one theory, and it's just a theory, but when you bring up a memory and then follow eye movements back and forth, there typically are thoughts or images or feelings stored in the brain somewhere that is not stored in a dissociated traumatic memory. Trauma memories tend to be walled off and separated from material in the brain that would soothe that memory. So one theory is when you stimulate both sides of the brain, that the trauma memory starts to blend in with some healing thoughts and healing feelings and healing images. And so that's why typically people will, after 1 or 2 or 3 or 4 sessions, will say, that old trauma memory that used to be so painful, it's shifted somehow. I no longer think of myself as that little helpless child being raped by 5 people. I'm outside looking in and I'm safe. Or something shifts in the body. So that's EMDR, and it's been accepted worldwide as a very effective trauma treatment. There are 2 therapies that impress me even more. As effective as EMDR, and our Department of Defense uses it to treat traumatized soldiers, there's a woman in America who has, to my mind, taken EMDR far beyond where it has been. She's an EMDR trained therapist, but she also has a background in art and theater. It's called Accelerated Resolution Therapy. Have you heard about this, Sabina?
No.
Okay.
But I will Google it. As soon as we finish, I will Google it.
Well,
But I will,
a lot of people have not, because it's relatively new, but I hope it gets to Europe soon, because all the things we've been talking about are incorporated into this. I call it a derivative of EMDR. So before they start trying to change the trauma memory, they'll say, let's just work on where in your body you feel those symptoms. When you think about, being emotionally abused, where do you feel at? So maybe I feel at my gut. Let's just follow my movements and let that experience settle. Then when all the visceral symptoms, the physical symptoms within your body, the emotions, when all those settle down, then it starts working on the image. Bring up the trauma image along with all the other aspects of the memory, and let's settle that with eye movements. Then after the image, the memory is settled, then you start to erase the image with eye movements and replace the image with any image that the person, the client, comes up with that feels better than the image of the trauma. And then after you've done that, and this often happens in 1 hour, it's just brilliant. Then they'll say, okay, let's imagine that you've resolved all your painful memories from the past, and you go to a bridge and you can dump all the lingering pain, and when you cross that bridge, you cross to a relatively normal future. The future looks bright, you're feeling happy, you're doing pleasant things, and let's reinforce that with eye movements. That approach seems to work even faster than EMDR. And EMDR will often help people in 5 sessions rather than a year or 2 of traditional therapy, talk therapy.
Wow.
Okay, now I'm just remembering you asked me another question about the art. Would you like me to explain that a little bit?
Yeah, just wanted to comment that this field of trauma therapy is so, is develops so fast, and there's so much amazing, approaches, research, and I think your book is filled with such approaches and science data, and I just love it. It can be just it can be a good start, but also a good for people who already work in therapy field, or they do trauma therapy, and they will get lots of techniques, lots of ideas, lots of just ready to use exercises to do with their clients. That's what I love about your work, that it's just you find many treasures in your books. They're for normal people, sorry for that, people, ordinary people, maybe not normal, and also for professionals. Just wanted to thank you, to express my gratitude to you.
It warms my heart to hear that, because so many of the books I've written were written out of frustration when people will say, well, what can I read that's user-friendly, down to earth? And I typically say, let me look, and then I couldn't find one. So I started writing these books, and as you know, it takes a long time to get your arms around a topic, and you spend years in isolation writing. When someone says that book saved my life or really helped me, it makes it worthwhile. So thank you. Appreciate that.
Yeah, I especially think that this one about ACEs is so powerful. It was, even reading it without doing all the exercises was just, for me, it was autotherapeutic. It was like, oh my gosh, it's that's what I can do in my life, also for myself, not not only for my clients. So it was just very powerful. But okay, getting back to expressive arts, I'm really interested in the topic. I have many friends who are art therapists. They use art in their therapeutic work, and I think they will be very interested in this part of our conversation.
Okay, so the other one that I'm really impressed with is something called intensive trauma recovery. Some years back, I was asked to keynote a trauma conference at a university in America, and it was organized by a psychiatrist, and his wife was a PhD art therapist. And the more I talked to these people, the more I said, these people are brilliant, I want to train with them. And they developed a therapy that is rapid, it's gentle, it doesn't re-traumatize, and it gives people a sense that the trauma is now in the past. It's not constantly intruding. And the way they do it, they say there's 7 stages of a trauma response. They call it the instinctual trauma response. And what they'll do, so back then, people would come to their clinic and live in a nearby motel or bed and breakfast and go there from like 9 to 5. And within a week, they could help people bring a trauma to closure, or if it's more complex trauma, it would take 2 weeks. So in other words, that was very attractive to people who didn't want to stretch out therapy for a year or two because they're deploying or traveling or moving. And so what they do in a nutshell, they don't use hypnosis so much anymore now because the husband has passed away and he was a master hypnotist. But what they would do is help people relax and bring the memory to awareness from a safe distance. You know, I'm looking in a screen, in a window at a shop, and playing out there on a television is my trauma. So you just kind of bring it to awareness, and then you draw a picture for each of the 7 steps of the instinctual trauma response. And so what that's doing in a very gentle way, bringing images and putting it on paper where it can be discussed out there. It's no longer, you know, something in my gut that's really hard to talk about. So the person will then explain to the therapist what happened in each picture. Then that therapist posts the pictures on the wall in a very gentle, kind way, says, okay, this is what happened. This was little Johnny when this happened, and Johnny was understandably afraid, and this is what happened in the next stage and the next stage. And Johnny is listening to that, John the adult, and hearing these kind emotions woven into his story, it starts to shift the story. And seeing that the story had a beginning, a middle, and an end gives you a sense that the memory is completed. It's just brilliant. And so
Wow.
I'll give you an example. I had a woman call me once and said, I'm moving to the other side of the country in 2 months, and my brother had been murdered, and I want to get this resolved. What do I do? So I recommended she go to these people, and several months later, after she'd moved, I talked to her and said, how did it go? And she said, well, the first week we processed my brother's murder, and the PTSD symptoms went away. The second week, we processed a surgery when I was 3 years of age, because in America, until 1987, we did not anesthetize children in surgery because we assumed they didn't feel pain. It's really a silly assumption.
Okay.
But she said, when we processed that surgery, and think about it, a little child is held down, they can't move, the stress response can't play out. So she said, when they processed this memory, my chronic low-grade depression lifted.
Wow.
So it's nice to have little stories to share like that with people who think, well, what does that have to do with my past? You know, I'm an adult now. I shouldn't be having these problems. And that should word gets us in trouble.
Yeah. I think that what you're saying right now will give hope for many people, that there is maybe just, you know, some better life for them. They don't need to suffer for the rest of their life. That there are, you know, different approaches, sometimes, you know, even that sound strange to people, because, you know, for some people, painting, drawing can be some strange technique, but it sounds so powerful. It's that there is hope in you know, in creativity, in creation. I really like this. I work a lot with my clients with crayons. I even have my, you know, own set of crayons that is like, you know, used right now, like, you know, because I use them almost every day. And I found it just, you know, a powerful intervention that people can not only talk about traumas, about, you know, experiences, memories, but they can draw something. And sometimes it's when people draw, they tell me, well, I didn't even know that I had this kind of memory. It came when I started drawing, that, you know, drawing is an act of recalling memories. Like it's really like, you know, witnessing the magic that really brains gives some other answers.
Yeah, what the old saying is, what the mouth cannot express, often the hand can.
Yeah.
It's in there. It just needs to get to the surface where you can do something with it.
I remember a few weeks ago, I had the tough period in my life, and I saw this, shop with things for supplies for artists, with paints, and I bought myself a sketchbook, and I started drawing my, my messed emotions, and it was so helpful. It was just so helpful to draw, not to, not only to think about. So, I think it's also some kind of it helps me not to burn out. Just draw sometimes. Wow, I would have so many questions to you, but I know that we don't have such time, such long time. But I would like to ask you one more question, at least, about the quotation that I found in your book, that aces are not all bad. Aces can spur us to be stronger, to learn new skills. And that's what I would like to ask you as well. When can these experiences made us stronger? Is there any group of people that is like more resilient because of something than the others? I read a lot of books of Holocaust survivors, people who were who experienced it itself, or their parents were Holocaust survivors. And for me, it's just, maybe it was the question that led me to psychology, because I read these books since I can remember, since I can read probably. And it was always my question, why some people, they're just stronger, and they some of them, they are even stronger after some experience than the others, and some are not, and some Holocaust survivors, they were like in depression for the rest of their life. So just wanted to ask you about that. What's the how does it happen that some are stronger, some are not?
I have pondered that myself. I see resilience as a staircase. So I may be here starting out and you may be here, but hopefully we can both kind of go up the staircase and stay above the rising tide of stress. Why people are different. Some are temperamentally born that way. Some come out stronger. There's epigenomes, there's genetic influences, there are parenting influences. But ultimately, to me, it doesn't matter where you or I start out. What matters is we learn skills to cope with whatever life throws at us. And I think this is the beautiful promise of resilience. We know there are skills. And when you look at the lives of people, including Holocaust survivors, who coped well, you see themes repeated. That they didn't get embittered, they didn't feel vengeful, they were able to forgive, they were able to not lose their sense of self-worth. There are coping skills, and I've interviewed World War II survivors who were in combat, including this wonderful Polish partisan. I'm not sure if you're aware of Irene Gut-Updike. Are you aware of her?
Yeah.
She was an amazing woman, and I marveled after I read her book. I thought, I wonder if she's really that warm and positive and optimistic. And she was. I flew out and interviewed her shortly before she passed away. But she held no bitterness. She stayed optimistic. She was kind, always kind. Just a warm-hearted individual. Viktor Frankl's work from World War II. You asked me what my favorite books were, and the first three that popped to mind were all around World War II. Frankl found that if people have a purpose, and that just doesn't pop into your life typically. You have to work at finding one. And then the other one that I remembered, Edith Eva Eger.
Yeah, the choice.
She also had lots of reasons to be depressed and suicidal, but she figured out a way to keep fighting and keep persisting. And so I think it's skills, I think there are skills that people learn, self-esteem skills, optimism skills, happiness skills, but we don't typically teach these skills to kids. We say, well, go learn math, and that's important. I'm not diminishing the importance of school, but there are coping skills that are teachable from a very young age. Some people don't seem to need it, but a good proportion of us, those skills really help us.
Yeah, this word skills is, I think it's really what someone will find in your books. I read 3 of your books, and they were all about that you can learn new skills. Sometimes sometimes you will need to be in touch with your pain. Your books are not only about, being positive, and they are about, that there is something maybe to be touched by you, to be in contact with. But your books for me are about growing as a human being, and about just not letting your past define you.
Yeah.
What is like beautiful. I really love your books, and I'm just happy that you had that time in isolation, and for writing them. So this is my thank you for you from the bottom of my heart. And for the last question, I would like to ask you a little bit more private question, but about books. I'm really interested in what are your favorite books? I mean, books you read for pleasure or for professional, development. What are them?
Yeah, so I always find people who overcame inspiring. So my favorite books are typically about people who lifted themselves and lifted others. So the 3 that I mentioned about, the Holocaust survivors, Viktor Frankl and so on, and Irene Good Updike and so on. But there are just amazing stories of people who did survive incredible hardship. And I am always curious, because I like to think all my work, I like to make people happy. I don't want to make people sad and suffer. And so I'm always intrigued by people who suffered but came out on top, or at least didn't lose themselves. Arthur Ashe is another one that comes to mind. He was an African-American tennis player, and in open heart surgery he contracted AIDS, because back then we didn't purify blood as well as we do now. And he died from AIDS, but he never got bitter. He said, if I ask why me for the bad stuff, I have to ask why me for the good stuff. And he remained gracious and loving and not bitter. So stories like that are my favorites, especially nonfiction. This is a true story about someone who really survived. Corrie ten Boom, again a World War II survivor. She forgave her cruel captor, and she said, I don't know how I did it, I just it happened, but it's something she'd kind of worked on, and so she's able to forgive. And so there are stories like that that I find incredibly uplifting. I'm going to be reading a book on Solzhenitsyn, if I'm saying his name right, who survived the Russian prison camps. It's just amazing what people can overcome, and after you read that, you go, well, I can maybe too.
Yeah. Wow. So I think that's what we have in common, this special interest in the stories of people who survived, and they just blossom. They don't they are full of life and vibrant, and are inspiration for others. Thank you Thank you very much for this opportunity to talk with you, and also just, have some new knowledge from you firsthand spread. And I'm waiting for your next book. If there will be any, I will be, the first reader here in Poland.
Yeah. Maybe that'll come out. This is number 14. My wife says maybe I should pull back a little bit. But we'll see. I have a few ideas. We'll see what happens. But thank you, Sabine. It's been a joy to talk with you as well. And I wish you the
Thank you.
best.
And have a nice day. Here in Poland, it's evening, but have a nice day, and hope to maybe talk to you once again.
That would be delightful.
Thank you. Bye.
Bye.